Hi.
Hi.
Everybody doing good?
We're still here.
So my name is Dr. Selena Mangassarian, and I'm currently a clinical neuropsychologist, and before I went into that field, I trained as a marriage and family therapist through the USC program, which is where my interest came in intergenerational trauma, not only of my own background of being Armenian American, but in general of traumatic life cycles, whether that be domestic violence or substance use. I just kept seeing patterns brain behavior patterns that didn't make sense to me when I was trying to do therapy with certain patients. And so a lot of what's been said today is definitely invaluable, and research is still going. But one thing that's really important about the Armenian genocide is that when it occurred, psychology was in its infancy. And so there was no initiative to collect stories, and there was no time to process the trauma, and there was no one really to talk to about that trauma. And once survivors moved on, there was, it was just continuing to survive. And so a lot of what happens, at least for the Armenian culture, is that unresolved trauma has just continued throughout the generations. Me personally, I went to a Armenian-based elementary school where, in the first grade, we weren't really supposed to know about the genocide or anything, but then you'd walk through the library and like the sixth graders' projects were everywhere, right? And so, you're seeing these horrible pictures as a 6-year-old, and you have no idea what it is, and then you start realizing, oh, this is what's going on. And to think that I've known this since the first grade, and there's still denial about this. The denial is the one piece I have found in therapy, at least, that is what stifles a lot of problems, because there is a problem with development of self-concept, self-esteem, integrity of who you are as a person, the respect of your background being validated. And so that's one thing I found, as many of the panel members said as well, to validate that emotional reaction to the trauma. And that piece of denial, not having that acknowledgement, is very detrimental to your self-development. And so what I had discovered was, as many people have said, is narrative therapy. Armenians, we love to talk, and we love to eat. And that's something that, across generations of survivors, regardless of background, food is so important to us. We're so afraid it's going to go away. Or you were kind of guilted into eating everything on your plate because your ancestors did not get to have that option. And so the narrator therapy is always helpful because it's giving a person a space to speak about what happened in a matter-of-fact way, because the denial has led to people speaking about things in a matter-of-fact way, not emotionally. If you, the clips that Christy showed earlier were great because we saw emotion, not just this is what happened. Right. And so one of the approaches for therapy that I found was the constructivist self-development therapy theory, which follows the RICH, R-I-C-H format. And so what constructivist self-development theory helps with is it builds safety and trust in a therapeutic relationship, which many people have mimicked today, that trusting others, outsiders, people who are not of our background is not a component of discrimination or prejudice. It's a component of keeping ourselves alive. Our parents, exactly like Christy said, like, why can they sleep over and I can't? Like, the story of my life, all of my teenage years. Hi, Mom. So things of that nature, trusting outsiders or learning how to develop that trust, because intergenerationally we are raised to be cautious not in a sense of people are bad, but this is what keeps happening to us, and we keep having to rebuild ourselves. So just keep an eye out, and it makes sense. You know, it makes sense to us. Another thing with the constructivist theory is that it creates a sense of control for the patient, that they get to set their goals and they're in control of their lives, not me as a therapist, not the agency, it's you. And you know, and there's so much oppression that's happened to the Armenian people even before the genocide, that you know, a lot of people don't recognize either. So there's a lot of ability to build that control. And the rich component of the therapy model is that, you know, you gain some respect in the therapeutic alliance by validating the feelings, validating the stories that your patient is telling you. Information is built because you're getting to share the information you know that's been passed down, that you know is true despite what anybody says. A connection not only with others, but intrapersonally and interpersonally, because you know, being able to connect with somebody who is actually listening to your story is a very empowering thing, whether it be about genocide, survival, or anything in your life. And then also instilling hope. You know, the purpose of life is not just to survive, it's hopefully to create a life of meaning. And that's what I would work on in therapy. And I would also look at, you know, on the neuropsychological point of things, if I had a patient coming in telling me that, you know, I can't concentrate, I can't think about anything, I just have nightmares, I don't sleep well, and all these criteria that we look for of diagnoses, and then I think, well, I don't think there's something neurological necessarily going on. I mean, if you're constantly worried and you're anxious and you're depressed and you're ruminating, of course your thought process isn't going to be up to par with what you need it to be. And so that was another interest area of mine. And just one thing that I found in my research is that the role of, like, you know, there's like the survivor syndrome, you know, like, oh, being guilty to be alive because your ancestors didn't make it. Armenians aren't necessarily in that realm. Instead, they have this this intense, not anger necessarily, but, well, yeah, anger. I mean, yeah, it's not, it sucks. You know, professional terms up here. Yeah, I mean, just self-development of who you are, your ego resources, your, you know, cognitive schemas of the way you see the world. There's just this pain and sadness. It's not this guilt that I'm alive. I'm grateful to be alive, but I'm pissed off that nobody's acknowledging what everybody went through for me to be alive here. And so there's this injustice and feeling of discrimination and prejudice and a lack of respect and dignity. And so what I found is that is what has been the most telling of success in therapy with somebody who has an intergenerational trauma background, where they get to be in control, they get to talk things out, and it's not, you're not judging, you're just, you know, taking an emic approach where, you know, their worldview is not right or wrong, and neither is yours, and then again, to check on your own biases, right? Because, you know, me as an Armenian American, I might think that another Armenian American or another Armenian's story might be very similar to mine, when in fact it may not at all. And so that is another component that I think is important as well. And did I answer everything?
Yeah. Yeah. That was, thank you. Okay. Are there some questions out in the field?